Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Alright, thank you for listening, everyone. Hi, I'm Michael, and you're listening to Policy and Rights here on Depictions Media. So we're going to start off with Justin Trudeau. There's been a number of companies that have retooled or adjusted the process so that they could develop personal protection equipment or equipment to be used by hospitals to help isolate patients with COVID-19. And Justin Trudeau is going to talk a little bit about that in this next segment. So hold on while we play that.
I'm going to jump in. Prime Minister Trudeau is speaking now. Let's listen in.
About the Ukrainian International Airlines tragedy that took so many innocent lives earlier this year. Even as we face this new crisis, families and loved ones continue to grieve and seek answers. I want to assure them and all Canadians that we have been working hard to get accountability and justice, even as we fight this pandemic. At the same time, we've also been developing a strategy with our other international partners to make sure that such a tragedy never happens again. Today, I'm appointing the Honourable Ralph Goodale as my special advisor for Canada's ongoing response to the downing of Flight 752. With his decades of extraordinary service to Canada, including as Minister of Public Safety, Ralph has the right expertise to guide our response to this air disaster and provide recommendations for best practices going forward. He will also continue to push to see families properly compensated. The second thing I want to do is share a story with you. A few weeks ago, Dave Caputo, the owner of a startup in TrustCore in the Waterloo region, called a meeting with his employees. With mounting concerns around COVID-19, Dave asked his team how they could repurpose their building materials factory to make products hospitals needed. A few days later, they had 4 prototypes drawn up. They decided to make large panels, which hospitals could use to subdivide rooms and isolate people with COVID-19 from other patients. Well, on Monday, panels made of fully recycled materials were delivered at no cost to several hospitals in the region, including Grand River, St. Mary's, and Guelph General Hospital. Dave and his team showed what Canadians do in difficult times. We don't back down from the challenge. We roll up our sleeves and we get to work. I know that this pandemic has been incredibly challenging for people right across the country, but we're also seeing the best of what it means to be Canadian. From coast to coast to coast, businesses are retooling to produce face shields, ventilators, hand sanitizers, and other supplies our healthcare professionals need. To make it easier for companies to help out during this critical time, we launched Canada's plan to mobilize industry to fight COVID-19 a little over a week ago. In the time since, we've spoken directly to almost 3,000 companies who've reached out to offer their help. Before we go any further, I want to thank all the owners and entrepreneurs and managers who've answered our call to action. This vital support comes at a critical time. And the way you looked around and said, not how can I keep myself safe, but how can I keep myself and my employees safe and help out in this critical time, is a real sign of leadership and a sign of what Canadians do best. In tough times, we pull together, we're there for each other, we put up our hands and we ask, how can we help? I also want in the same vein to thank everyone who's making, shipping, and delivering these products. people who work on the manufacturing sector and in terms of getting people the items they need are on the front lines of this fight. Our country needs you through these tough times, and we thank you deeply for everything you do. Lorsqu'on a annoncé le plan...
When we announced the Canadian plan to mobilize the industry against COVID-19, we said that we were on the point of signing agreements with Spartan Bioscience and other companies of their ilk. Today, we're announcing the signing of supply contracts with 3 Canadian companies to manufacture medical equipment, respirators, surgical masks, and tests. I'd like to point to the work done by Minister Baines, who's played a leading role in concluding these agreements. We've also signed letters of intent with 5 other companies, Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. By mobilizing industry, we'll be able to produce here at home the goods that our healthcare professionals need to protect their own health, to treat patients suffering from COVID-19 and break the spread of the virus as well.
Our plan to mobilize industry, we said that we were close to reaching agreements with Thornhill Medical, Medicom, and Spartan Bioscience. Today, we're announcing that we have moved forward with contracts with these 3 Canadian companies to make medical supplies such as ventilators, surgical masks, and test kits. I want to recognize the great work Minister Baines has done to make this happen. We've also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed. Plusieurs entreprises ont également fait des dons d'équipements et de matériel.
Several companies have donated equipment and medical supplies to deal with COVID-19. Alibaba, for example, has sent 500,000 surgical masks and 10,000 test kits to help us out. COVID-19 Medical Support, which is an organization which brings together healthcare professionals, engineers, entrepreneurs, and representatives of NGOs, is working with several other companies to provide medical equipment. To date, they have obtained a commitment from Bombardier, from 3M, from Metronite to produce PPE. And Toys R Us has also committed to provide baby monitors to Canadian hospitals to provide for better communication between healthcare professionals and patients. These monitors will also help to prevent fruitless moving about by staff in hospitals, which can put people's lives in danger. I'd like to thank all those companies who have stepped up to the plate. You're doing your share, and all Canadians should follow your example.
Question that we will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you. If you stay home and follow public health recommendations, you can slow the spread. And that means fewer patients in our hospitals, fewer people to test, fewer ventilators to use on critical patients. So keep doing your part and help us keep Canada safe. Merci beaucoup.
Okay, in this next segment we have Dr. Bonnie Henry and Adrian Dix from British Columbia, giving an update to people in British Columbia, which we actually are, about what is going on with COVID-19 and next measures to be taken. So here we go with that segment. After that segment, I'm going to introduce a new segment where we have a personal development coach come and talk to us about how we can deal with being self-isolated, because we're under self-isolation. It's going to be many more weeks that we're going to be under such measures like this, where we won't be able to get out as much as we like and things. So she's going to have some ideas of how to help us deal with the stress of COVID-19. So listen to that next segment after this one.
Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the traditional territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. We'll be briefing here tomorrow at 3 o'clock as well. And with that, I'll introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for our update today, to start with, our number of new test-positive cases is 43 today, which brings us to a total of 1,013 people in British Columbia who've tested positive for COVID-19. Of those, 476 were in Vancouver Coastal Health, 348 in Fraser Health, 67 now on Vancouver Island, 107 in the interior, and 15 in Northern Health. In addition, we're up to now 19 long-term care homes or assisted living facilities, all of them either in Fraser Health or Vancouver Coastal Health, where we've had outbreaks of COVID-19. I will say, however, that this reflects a very low threshold for declaring an outbreak, and all of the screening that we have been doing and focusing on in terms of trying to protect our long-term care homes. We know we have two particular outbreaks that started early on, the Lynn Valley Care Centre, of course, and the Harrow Park Care Centre. And both of those are really full-blown outbreaks where we have a number of both staff and residents who have been affected, and unfortunately that is where we have had most of our deaths. But the other ones really reflect the fact that we have taken such an aggressive approach to monitoring, to testing, and to preventing illness coming into our long-term care homes. And the fact that we now have 19, but the vast majority of them have a single person, either a staff person or a resident who was detected with this illness. And we've been able to put in place the outbreak measures so that others are not affected, and people are effectively isolated or removed from the home in terms of the healthcare workers so that we aren't transmitting it. And I think that's a really important thing to recognize. So currently, as of this morning, we have 128 people who are hospitalized across the province with COVID-19, and of those, we now have 61 people who are in ICU. So the ICU number is very close to yesterday, although I will say, as I mentioned yesterday, people go back and forth between the ICU or the high acuity units. We have had a policy very early on of ventilating people early to help them recover from this, and that is reflected by the numbers that are going in and out of ICU on a daily basis. So that's the census as of this morning. It's not the same 60 people that were in the ICU yesterday, but it is the number who are now receiving critical care. We have 507 people now fully recovered and out of isolation, and we have an additional 5 deaths, unfortunately, 4 of them in Vancouver Coastal and 1 in Fraser Health, bringing our total fatalities now to 24. In addition, I want to report today, Interior Health is investigating our first large community outbreak, which involves a group of temporary foreign workers in housing at a West Kelowna agricultural business, Bylands Nursery. So this business has been closed to customers. Interior Health became aware of a number of the workers there with respiratory illness, and a number of them have now tested positive for COVID-19. The business itself is being quarantined, and everybody is able to be isolated effectively in the housing, the very good housing that is on site there. And we want to thank both the workers themselves and the owners and operators of the nursery in being fully cooperative, and everybody is being cared for very well, and the investigation is ongoing with Interior Health on that community outbreak. There's a number of things, as you're aware, that we've issued some guidelines on that have come out recently, on the orders that we've put in place over the last little while. These guidance documents have come out so that we can have some consistency in the applications of the orders that we've put in place to protect people here in BC. So yesterday there was some detailed guidance around industrial camps. Later today or early tomorrow we'll have some guidance for municipal bylaw officers and other law enforcement officers. And while I can call on peace officers to help enforce orders, it is a last resort. As we talked about before, the way that we need to work together on ensuring that people are taking the measures that we need them to take, whether that's being in quarantine if you've been a contact of the case, whether that's being in isolation if you are sick yourself or you've returned from travel to a country outside of Canada. Those are legally enforceable orders by public health, but we know that most people are doing what we're asking them to do and are doing the right thing. So that is the approach that we need to continue to take, that we're all in this together, and that allows us to ensure that people aren't hiding things and aren't afraid of coming forward and working with us if they become sick. One of the other things that we have done in the last week is put in place a protocol, a first responder dispatch protocol for the pandemic. And this is really an important way to protect our non-paramedic first responders. As you may be aware, for many calls to 911, dispatch will dispatch not just a paramedic, but in particular our first responder firefighters who are trained in advanced first aid and other measures. And during a pandemic, when we know that personal protective equipment is so important for our healthcare workers, for our paramedics, and we want to avoid exposing as many first responders as possible, the protocol allows for paramedics to be dispatched only to most medical calls unless there's a need for backup from either police or fire services. So I think that's a really important measure that we want to make sure protects our non-paramedic first responders and ensures that our paramedics are able to respond effectively with the personal protective equipment that they need. And finally, I'll just say we are, as I mentioned yesterday, at a critical juncture. We are watching very carefully across the province. We are still testing around the province. We're testing our focused areas, as we've mentioned, on long-term care, on our hospitals, but we are also continuing to do our surveillance, our testing of any swab that is sent into the lab for respiratory testing, and our influenza sentinel surveillance network. So these are really important measures to help us understand what is happening. And this is our critical time here in British Columbia, the next 2 weeks. We must be true to who we are in BC, and we know that all of us, most of us, are doing the right thing 100% of the time. No one is immune to this virus, but everyone can make a difference. So we need you to do those things that we've talked about. Avoiding unnecessary travel, particularly to smaller communities where they may not be able to support you if you get sick and where we don't have as many resources. If you're older and you're more likely have severe illness from this, please stay at home to reduce your risk, and we as a community will support you to do that. If you're younger, stay apart. That is our duty to make sure that we're not connecting and transmitting this virus between us and bringing it home to those that we care about in our family and our community. So this is the time, as we've said in the last couple of days, it's to be 100% committed to keeping this curve flat, to not allowing the surge and the outbreaks in our communities. So taking care of our loved ones by doing your part, by staying home if you can, and by staying apart, and of course by staying connected virtually.
Thank you, Dr.
Okay, welcome back, everybody. I brought back with us best-selling author, inspirational speaker, life coach, energetic clearing practitioner, Katherine Johnson. She has spent over 15 years studying consciousness, personal growth, self-improvement. She's born with cerebral palsy. Katherine is living with a disability and has given a unique perspective on the world. Her passion is about living at her potential. Katherine has competed in athletics internationally for Team Canada and has won several medals, including gold. She has earned a bachelor's degree in psychology, an honors diploma in business administration, a professional accounting designation, and Katherine wants to share her unique perspective and her passion for life to help and inspire others. And she, luckily, you're here with me near Vancouver, right? Yeah. So, welcome back to the show, and we're all sitting here right now in the middle of this COVID-19 thing, and we're kind of basically we're told to self-isolate. It's not quite lockdown, but if we don't have a real reason to go out, we shouldn't. And I'm sure that it's creating like some personal stress for people, and you have some tips to help people get through this time, don't you?
I certainly do. Thank you so much, Michael, for having me back. It's my pleasure to be here. I'm going to start with, I have 10 or 11 tips for everybody today. And one of the big things is mindset. So what is going on in your head when things are stressful? Because I believe the majority of stress we actually feel is we feel because of our thoughts, as opposed to what is actually happening physically. So, the first thing I'd like to share is some things that I say to myself. So when I start getting scared of something, I say to myself, is it happening now? Is there anything I can do to make it less likely to happen? And then I decide that I refuse to give my energy to anything I don't want. Because if we focus on what we don't want, we increase the likelihood of it happening. And then I also know that I personally have a belief that when it does happen, myself and the power that's creation will handle it. That I have this inner knowing that if it's staring me in the face, I'll just deal. Because honestly, if it's staring me in the face, we have to. It's right there, and we just react at the time. But knowing about it ahead of time is probably way worse than actual difficulties we face.
Right. We're worrying about something that hasn't even happened yet, and we're taking ourselves off from what what is actually happening to us, it could be really, really good, right?
Exactly. Which leads me to my next tip. Has to do with some deep breathing. And it would be really cool if the audience would join me right now, and we're going to do some 3 deep breaths. And you breathe in deeply, and then when you exhale, you breathe out slowly as if you're breathing through the straw. And I'd love it if everybody would just see how it is for them and see how quickly they can find things can change for them. So, in, and out slowly through the straw. And one more time in, and out slowly through the straw. And the last time in, and out slowly through the straw.
Wow. It does feel better.
It does. I love it because you can do that from absolutely anywhere. It takes just a few seconds, and you don't need any equipment or anything. And even if you're the type of person who has trouble with deep breathing, can visualize deep breathing in and out. It'll have the same effect.
Very cool.
Yeah. My next tip has to do with being grateful. Often we look at things and our brain tends to focus on the negative in things. They say that human nature, negative things are like Teflon. They stick to us like crazy. But the key is to really focus on the good in the situation. So we're at home, and it's stressful because it's change, it's new, and it's uncomfortable. And we don't have the commute. Maybe we have more time with our kids or our pets, or we have time for projects that we've been neglecting, or we have more time to, maybe bake some cookies with your family or something. There's all kinds of good things happening right now. One thing I've noticed is the way people are behaving together. It's just the generosity and the goodwill and the good spirit that I experience every day with my neighbors is incredible. I talk to people that I don't usually talk to, and all of a sudden, everybody's here for each other. It really feels quite beautiful.
That is very true. That a lot of people are stepping up and helping others, and like for our elders in our community, I've heard a few stories of people going and buying groceries or their prescriptions or something and dropping them back off their door and things. It's pretty awesome that way. So.
Yeah, I think we're all learning how special the people around us are, and I think we're all noticing some beautiful and wonderful things. I have a few more tips.
Okay.
Good nutrition is definitely important to keep ourselves healthy, but now more than ever, I find not only will good nutrition make it less likely for you to become ill, but it'll also help you feel better. I definitely feel better when I eat my veggies and get my greens and drink lots of water. I definitely feel better just by doing that. Sleep's really important, especially if you're stressed. Make sure that you get good sleep. Movement is key. So even if it's just, walking down the hall in your apartment, just move, change your scenery. And believe it or not, I personally like to dance. That's how I move, because I can do that in my apartment. I can just get some music from the internet, and I can just be crazy and let off some steam. That's really, it's just physically moving your body in whatever way you can, shifts your energy. So if you're feeling stressed, movement is really key.
Yeah. What about movement that helps us relieve that stress or feel better? What happens there?
Well, you're physically shifting.
Mm-hmm.
And through physically shifting your body, you're automatically changing your mindset because your focus is on something else. And so it actually just moves energy, moves your attention, moves any sort of stuck negative energy within your body, releases it. There's endorphins that are released when we move. All kinds of hormonal changes happen when we move. So just moving, period, makes a difference. It doesn't have to be a workout or a big deal. Just even clapping your hands will make a difference, you know?
Very cool. So when we move and do that, you instead of releasing like the stress hormones, we're releasing the happiness hormones into our brain?
Yes.
Awesome.
As long as you're doing something that's making you happy,
Mm-hmm.
you know, do something that's a positive movement for you that feels good, then you will absolutely be releasing those happiness endorphins.
Very cool. Okay. Mm-hmm.
I have a few more tips. Also, you mentioned earlier, stay connected as much as you can, even though we're told to stay home. Remember your neighbors and your family and your friends. Pick up the phone, arrange a Skype call or a Zoom call. You know, it really makes a difference just to say hi. And a lot of people really appreciate it, especially if they're in quarantine right now. They really appreciate just a hello. And I find when I do something nice for other people, I feel better too. So keep that in mind. It's also important to keep your routine. So even though you're stuck at home instead of going to work every day, you know, get up, get dressed, have a routine as if you were in your work day, and we want to keep that as much as possible.
Okay, well, why would that be important to keep it? Because we're stuck at home. Why would it be important to keep that whole routine going?
Because studies have shown that it's very easy to become complacent. I mean, we need a mental separation between sort of home and work. So if we're working at home, that separation becomes blurred. So it's important to keep your routine that, okay, I'm getting up as I normally get up. You might adjust slightly because you don't have to deal with commute, but you still might get up and get showered and dressed as if you're ready to work, so that your mindset, again, is focused on work. And then at the end of the day, you can unwind and sort of be in home mode. But if you stay in your pajamas all day and work from your pajamas, you don't have the ability to have that transition.
Oh, okay.
It just becomes either your home becomes a reminder of the office, or you're less productive because you're kind of in home mode, Saturday mode, and you're just less present for serving your customers. They've done studies also that people who work from home if those people working from home are working in their pajamas or working in some form of, not dressed and ready for work, the person on the other end of the phone can tell. Their tone of voice and their beingness for the customer is just of a low quality. So we want to make sure that we continue giving that customer service to your clients and the people you work with while you're at home.
Wow. It's just one of those things I don't think we ever think of, that we have these different modes in our brain that way. It's very cool to know.
Oh yeah, separation is key. Just like in our house, we have different rooms for different things in our house. Mm-hmm. Our day is also compartmentalized, so it's important to have that time and space for different emotions, different moods, different activities. It's a mental thing we want to keep going.
Okay, cool. You still have a few more tips, right?
I have a couple more. Also, I find for me personally, it's much easier for me if I'm working in a clean, uncluttered space. I just find that I think a lot clearly and I'm a lot more productive. So I would encourage everybody to keep that up as much as possible. And finally, I recommend a meditation practice. If you don't know how to meditate, there's some relaxing music, all different kinds of relaxing music on the internet. You could just Google meditation music, and I'm sure you get plenty of options.
Very cool. How long do you meditate for?
And that's it for my tip.
So.
Any questions?
Yeah, how long do you actually meditate for?
I meditate twice a day for 20 minutes each time. And I have a mantra that I use.
Okay.
And it keeps me centered and grounded.
Yeah. Now, when you talk about a mantra, it's like something that you repeat. You say it several times while you're meditating, or how does that work?
Well, there are different meditation practices. The meditation practice that I use is Sahaj meditation, and our mantra, we say it silently to ourselves. Mm-hmm. So we're saying it in our heads, and it helps calm the mind. That's the purpose, and it's something to focus on, and it gives us rhythm.
Okay.
And so because that rhythm becomes automatic, the more and more you meditate, when things get a little crazy in the outside world, you're not really affected.
Right. So it kind of gives you a place to go to where you know things are good.
Yeah, that's true. I mean, when you meditate, I definitely do feel more relaxed in the meditation process. I also notice, though, because I meditate twice a day, that when there is stress in my life, or when there is, we call it stress, when there is something unexpected, I don't react. Because that feeling of being centered and grounded is just automatic. It's just normal, and it is my consistent way of being, regardless of what happens in the outside world.
Okay, very cool. Thank you, Catherine, for your tips. I mean, I know I'll find them very helpful and useful. It helped me get through this time also. Because, hey, I'm out. It's kind of stuck away from getting to a radio station and the studio and all that kind of stuff, so I'm stuck here in my home office, so what are the best ways for people to get a hold of you if they want to work with you or get more tips?
They can contact me through the contact page on my website, which is inspiredbycatherine.com.
Okay. And, hey, is your book still for sale? And where do they find that?
Oh, absolutely. My book, The Joy of Obstacles, is available on my website. There's a link directly to Amazon on my website. So again, if you want to know anything about my services, just visit my website, inspiredbycatherine.com. My book is available in 3 formats: print, audiobook, and ebook. And again, I offer coaching and energetic clearing. And what energetic clearing is, quickly for those people that don't know, it's when you undergo difficult times, the stress of those times imprints on our DNA and within our body in some way. And we get stresses and aches and pains and sore stomachs and sore shoulders and all this kind of things. Headaches, you name it. It's not good. And so what energetic clearing is I get my clients to focus in their body wherever they're feeling some kind of discomfort. And then they focus and I get them to breathe. And through breathing and an intention that I set, the discomfort gets released. It's really quite amazing. It doesn't take very long at all a lot of times. And my clearing practice works for not only emotional things, as I mentioned, but it also works for physical difficulties as well. Results do vary from person to person, but I know people, for example, if you've had a bad back for years, I could help you. We could work together and see what happens there. So if anybody has any questions, please feel free to contact me and book an appointment. Happy to help.
Okay. All right. Thank you so much, Catherine, for joining us for today and sharing your tips and what you actually do to help people. Okay. Have a good day. Okay, and thank you everybody for listening today, and we will talk to everyone again tomorrow. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.